As the weather gets warmer, many parents with young athletes in the family are starting to think about getting them ready to compete. We're joined this morning by Dr. Dave Bernhardt, a sports medicine pediatrician with UW Health Kids in Madison, to discuss those pre-participation physicals that may be required. Good morning, Dr. Bernhardt. Thank you for joining us.
Good morning, Caroline. Thank you for having me.
Of course. Well, first of all, what is a pre-participation physical and why is it so important for student athletes?
Well, the main thing that the parents think is, and probably the adolescents as well, is it's a form that needs to be signed, required by the State High School Athletic Association to make sure that it's healthy, or the kids are healthy, in order to be cleared to participate in sports.
Very important. And how does this exam actually make sports safer for young athletes?
Well, that's the problem. I don't know that it actually does make the sport safer. Obviously, we screen for cardiovascular conditions, and we screen for orthopedic injuries and histories of concussions, but I don't know that just going through the screening actually makes the sport safer for the majority of the adolescents who come through. The real reason for doing this is it's often the only contact that we have with the adolescents, so it's a chance to provide anticipatory guidance or counseling for these adolescent athletes when they come in to our clinic for things like potentially recreational drug use, sexual activity, depression, anxiety screening. Really, it's a comprehensive visit with a little bit of the athletic screening as part of it. And I think it's very important to understand that this should be done in the primary care provider's office, not necessarily at the high school or some other sort of mass pre-participation evaluation that sometimes is offered at the school.
I see. So getting them prepared more so for really just the rest of the school year and life in a way in their upcoming teen years. But when it comes to these exams, are these exams more important than a checkup routine? How do they help kids get ready for what's ahead?
Well, I think it is important in terms of education to talk to them about preparing for sport. And that's the issue is right now in terms of the spring sports, they've already started and there's kids who haven't even had their physical yet. And I call this the #1 summertime sports medicine emergency. The kids forgetting that they need to get this done. And they call the week before football practice or cross country practice or soccer practice and say, I need to get this done. And the doctors and primary care providers don't have any room or access. And we don't want to have this exam be the obstacle to them participating in sport. So I do encourage people to get this done as soon as they can so that they're ready for the upcoming season. And if we do find something, so let's say that we find a heart murmur or there's something on the screening and we need to refer that person, it takes time to get into the next subspecialist to get tests done to be cleared. So it only delays things more. So in terms of thinking about this pre-participation evaluation, you might be like, why is this doctor talking about it in the spring for fall sports? It's because access can be a problem. And so you want to call your provider to make sure that you get an appointment for the summer so that everything can be taken care of.
Especially with fall sports coming, you recommend them getting in the summertime, most likely, correct?
Correct. Anytime after May 1st is great.
Wonderful. Dr. Bernhardt, thank you for joining us this morning.
Thanks a lot for having me. Have a great day.
You as well.